Remember to subscribe and don't forget to hit the bell icon to never miss an update from First Cry Parenting.
IVF versus IUI, which is good for you? The two most common fertility options are intrauterine insemination, IUI, and in vitro fertilization, IVF. Difference between IUI and IVF. IUI and IVF are often confused with one another, but the difference between the two is quite large. Procedure. In IUI, the sperm is put into the woman's uterus during the time of her ovulation. In IVF, fertility medications are used to activate the ovaries. The embryos are grown in the lab and are injected into the uterus via an embryo transfer process. IUI pros. It requires little medication and is less invasive than IVF. The procedure takes only a few minutes and causes very little discomfort. IVF pros. IVF allows for PGT, pre-implantation genetic testing. It is suitable for women with damaged tubes and couples with endometriosis or male infertility. Risks. IUI carries the risk of gene defects, especially since they are bypassed rather than treated. IVF carries a bigger risk of chromosomal defects and higher-order multiple pregnancies, triplets or more. Success rate. According to statistics, IUI has a lower success rate than IVF. The gap widens as a woman grows older. IVF has a high pregnancy rate, but not all conceptions go up to live birth. This success depends on variables like the patient's age, the type of sperm used, etc. Cost. An IUI process costs a lot less compared to an IVF process. Time factor. If your first IUI is successful, you could bring home a baby much faster. Over 40 years of age, patients are suggested to go for an IVF. It is faster rather than multiple unsuccessful IUI cycles. Whether you choose IUI or IVF, the first step is to find a trustworthy fertility clinic that considers your individual needs more important than a followed protocol.